Knock, knock, knock. Hello, Mr. Warnock. My name is David. I will be your student nurse today. Can I have your name and date of birth?
Kevin Warnock, July 14th, 61.
Thank you. That matches your wristband. Awesome. Like I said, my name is David. I'll be your student nurse today. We're just going to go ahead and do a head-to-toe assessment. Go ahead and close the curtain for privacy. Do you have any questions for me before we get going?
None?
Excellent, cool. And as I come into the room, I would inspect for any tubes, drains, lines, any respiratory equipment surrounding the area, environment, and see if there's any tripping hazards that could be a safety concern for either I or my patient. All right, you don't have any questions for me. I do have some questions for you, though. I do ask all of my patients this. Have you had any mood changes or any depression, anxiety?
None?
Good. Have you had any thoughts of suicide or homicide?
None?
Good. As far as your home environment, do you feel safe at home?
I do?
Good. Awesome. And I would assess my patient. He seems well groomed. His attire is appropriate for the environment. Excellent. Cool. All right, a few more questions. Do you know where we are right now?
Yes.
Where are we?
St. Alphonsus Hospital.
All right, good. Do you know why we're here?
Just for a checkup for me.
Good. Do you know about what time it is?
It's about 9:30.
Good. And do you know who I am?
You're David, my student nurse.
Excellent. Patient is alert and oriented times 4. Awesome. If you want to, go ahead and grab my fingers and give them a squeeze for me. You're not going to hurt me. Excellent. Thank you. Good. Have you had any dizziness or headaches?
Nope.
Good. Have you had any trouble with your sleep? Any problems either falling asleep or staying asleep?
None.
None of that? All right. Good. Excellent. Next, I'm going to go ahead and assess your scalp here. Just going to ask, let me know if you have any tenderness anywhere that I'm palpating. Any tenderness?
Nope.
Good. How about over here?
No.
Good. Excellent. Patient has no bumps or bruises, no irritation, no tenderness. The hair is well groomed and an even pattern, very full. Excellent. Next, I am going to assess the patient's eyes with my pen light. All right, Mr. Warnock, I'm going to go ahead and shine this light into your eye. Block this side here. Excellent. Perfect. Patient's eyes are equal, round, and reactive to light. Next, I'm going to assess the patient's ears. I will shine my light into the ear. No excess drainage, no damage, no irritation. Good. Next, I'm going to assess the patient's nose. The nose appears straight. The septum is not deviated. Go ahead and shine my light up your nose here, Mr. Warnock. Good. No excess drainage. Excellent. Next, I'm going to shine my light in your throat. If you could look up slightly and say ah for me.
Ah.
Excellent. Thank you. Mucous membranes appear moist and pink. No signs of irritation. Excellent. All right. Next, we are going to assess your respiratory system. Have you had any trouble breathing, any shortness of breath?
None.
Good. All right. I'm going to go ahead and listen to your lung sounds now. With each place that I place my stethoscope, if you could just go ahead and give me a nice full breath. Excellent. Let me know if you get lightheaded. Excellent, thank you. We're going to go ahead and do the same thing except on your back now. You lean forward for me. Excellent. Thank you, Mr. Warner. I heard no wheezes, crackles, rhonchi, or anything of the sort. The patient's skin appears to be normal color. Temperature is warm. Color is appropriate for ethnicity. All right. Moving into the cardiac system. Have you had any trouble with chest pain?
No.
All right, good. Have you had any trouble or noticed any irregularities in your heartbeat?
No.
All right, good. All right, now I'm just going to go ahead and listen to your heart sounds now. You can just breathe in normal. I'm going to place my stethoscope on your chest. Excellent. I am now listening to the aortic heart sounds, and now the pulmonary valve heart sounds, followed by the tricuspid heart sounds, and now the mitral heart sounds. While I am here, I would assess the patient's apical heartbeat for a full 60 seconds. So I'm going to assess your apical heartbeat for 60 seconds, Mr. Warner. All right, good. That was a full minute, and your heart rate is 70, which falls into normal limits. All right. Next, I am going to go ahead and assess your radial pulses. If I could have your wrists. Excellent. Pulses are equal and bounding bilaterally. I will also assess your pedal pulses. Excellent. They are equal bilaterally. There are no signs of edema, no pitting edema. Your skin is warm. Circulation appears to be good. I would also assess your capillary refills on your fingertips. They are within 3 seconds for sure. Excellent. I would do the same with your toes. Capillary refill with your toes is also within 3 seconds. I am also noticing that the AP to T ratio is good. No barrel chest. It is 1 to 2. Excellent. Next, I am going to inspect your abdomen. If you do want to lay back for me, lay flat on the bed. All right, I am assessing the abdomen for relative flatness. Have you had any changes in your diet, Mr. Warnock?
No.
Good. Have you had any nausea, vomiting, or diarrhea?
No.
Good. Excellent. I'm going to go ahead and listen to your bowel sounds now. Go ahead and just breathe normally for me. Listening to all 4 quadrants. All right, excellent. Thank you. Next, I am going to palpate your abdomen. I'm just going to feel around. You let me know if you have any tenderness or if you want me to stop. Any pain or discomfort?
None.
Excellent. Good. I don't notice any masses. There's no apparent tenderness or irritation. Good. When was, you can go ahead and sit up now. When, asking you a few more questions, when was your last bowel movement?
About 2-3 hours ago.
Okay. Have you had any trouble making a bowel movement?
No.
Good. Have you had any trouble voiding, urinating?
No.
Good. All right, jumping into your musculoskeletal system. If you could go ahead and put your hands out like this for me, and go ahead and do a bicep curl. Pull me towards you. Excellent, and push me away. Good. All right. Doing range of motion, if you could just put your hands out to the side for me. Excellent, maybe straight over your head. Can you twirl them around and circle a little bit? Good, excellent. Can you stick your feet straight out in front of you? Good, and the other one? Good. Can you spread them apart? Put them together? Excellent, thank you. Can you go ahead and press up against my hands? Excellent, and pull back? Good. How about pointing your toes up in the air towards me? Good, and down. Good. Excellent. All right, Mr. Warnock. Next I'm going to have you stand up and perform your gait for me. If you could just walk over to the fireplace and back. Excellent. Thank you. Cool. While I have you standing up, I will have you go ahead and bend over and touch your toes. I'm going to assess your spine. Excellent. Thank you. You can stand up. Your spine is straight. No signs of abnormal curvature. Awesome. You can go ahead and have a seat for me. Wonderful. Awesome. Lastly, I'm going to continue assessing your skin. I don't see any bumps, bruises, rashes, scars, lesions, or any irritation. The skin is a good temperature. It is warm to the touch. Wonderful. There is no excess moisture. All right, Mr. Warnock, I believe that is it. Do you have any other questions for me today?
None.
All right. Well, excellent. I will lower your bed and make sure you're safe. I will give you your call light. Go ahead and give me a call on that call light if you need any assistance. And you have a great rest of your day.
Will do.
Thank you.